How would you like to have each person in your organization not just understand your vision for new healthcare initiatives, but take action on them? Right now, healthcare in the United States is going through a time of critical change. Any leader in the healthcare sector could tell you that. In fact, many leaders have great plans on how to change and survive these times. The problem is, so many leaders are great at developing plans, but terrible at spreading them through the organization. Some sectors may be able to get away with this, but with HCAP scores being tied directly to reimbursement, healthcare just can't afford to have this kind of disconnect. Former Secretary of State Colin Powell sums it up pretty well. He says, "Great leaders are almost always great simplifiers who can cut through argument, debate, and doubt to offer a solution everybody can understand." Critical word, everybody can understand. Walking into many healthcare systems today, it's hard to miss the worry and anxiety. It seems like reimbursements are being cut while standard of care has to be increased. In other words, doing less with more. The good news is there are great leaders and strategists in many organizations coming up with new ways to make this work. The problem is so much of their plan is lost in translation that the rest of the organization often doesn't get a hold of their vision. Like the old saying says, change is inevitable, progress is optional. The truth is many leaders in the healthcare space don't need a new solution to their problems. They've already figured it out. They need a new way to tell the rest of their team about it. Otherwise, nothing happens. So if you're a hospital or healthcare system C-level executive, VP, or director who has struggled to get organization-wide buy-in in the past, and you're looking for a way to break through the mental blocks that make it hard to spread new ideas, this presentation may be relevant for you. Now, one of our clients, Yale New Haven Health, needed to explain population health in a way their whole organization could easily get. This was a big change to their business model, and there was the potential for a lot of worry around it. On top of that, if they couldn't get employee buy-in, their engagement rates would suffer, which instantly impacts HCAPs. After working with their senior leaders to clarify their idea, we helped them to distill it into its core elements and wrap it in an easy to digest and motivate package for their entire organization. Another client of ours, the Cleveland Clinic, recognized that the landscape is shifting, but they needed help pushing it throughout the organization. They really impressed me with how committed they are to boosting quality of care at every level, and they know this message needs to break through in a new way. The beautiful thing about this process is it brings a fresh approach so your employees don't instantly shut off or ignore your message. It helps large organizations that move slower than they'd like to get excitement spreading organically. When Ethicon from Johnson & Johnson launched a similar idea campaign, it spread like wildfire through their firm, which was exciting to see. Plus, it has worked with other healthcare and even medical device organizations. The thing about it is these results don't happen by luck. Each message is a puzzle, kind of like a combination lock. The problem is a combination lock has over 10,000 possible combinations. You can try them, or you can piggyback off our specialized work. This is the only problem we work to solve. You call a locksmith for locks, you call us for messages. The fact of the matter is, we're looking for a few more dream partners who are looking to have a big impact on healthcare. If you feel like this is right for you, go ahead and click the button below and apply right now. The process is simple and it should take less than 5 minutes to complete.